Good afternoon. Joining me from the Maryland Department of Health are Secretary Dennis Schrader and Deputy Secretary Dr. Jinlene Chan, along with Dr. Monique Swallow-Burke, the Vice President of the Maryland chapter of the American Academy of Pediatrics, and Dr. Michael Zollicoffer, a pediatric medicine expert who works in partnership with Sinai Hospital of Baltimore. For months, we have been pressing the federal government to provide patients with clear guidance and a clear timeline for vaccinating younger children against COVID-19. Last week, the FDA's advisory panel of medical experts voted unanimously to recommend the Pfizer vaccine for 5 to 11-year-olds. And late last night, the CDC officially granted final authorization, making 515,000 Maryland children immediately eligible to get a COVID-19 vaccine. This approval followed a unanimous vote of the CDC's Advisory Committee of Experts. It is based on data submitted by Pfizer, which shows that its vaccine is safe and 90.7% effective against symptomatic COVID-19 in children, as well as thorough and rigorous clinical trials. Both the American Academy of Pediatrics and the American Academy of Family Physicians, two of the nation's preeminent groups representing hundreds of thousands of family doctors and pediatricians, agreed with the CDC's recommendation to authorize COVID-19 vaccines for children. Earlier today, Maryland health officials authorized providers all across the state to immediately begin scheduling appointments, holding clinics, and vaccinating 5 to 11-year-olds in Maryland. Our state health team has been working for many weeks in anticipation of federal approval to mobilize detailed operational plans for vaccinating children. Based on requests from providers across the state, Maryland placed an initial order of 180,000 doses, which began arriving directly from Pfizer earlier this week. Some of these doses are already in place and ready to go across the state. However, the White House has said that it will take them a bit more time to get all of those doses distributed. We will be receiving additional allocations in the coming weeks, and they have committed to supplying enough capacity for all of our 5 to 11-year-olds. Through every step of this planning and preparation process, state health officials have been working closely with pediatricians, pharmacies, local health departments, as well as with the Vaccine Equity Task Force. We have also been coordinating with local school systems and strongly encouraging them to hold clinics in their schools. I'm pleased to report that all 24 local school systems have agreed to do so. In addition to schools, we've been working together with our pediatric advisory panel on plans enabling pediatricians and family physicians all across the state to be able to provide vaccines directly in their offices. Our pharmacy partners are receiving allocations from the federal government, and they will also begin immediately offering the vaccine for children. Through our vaccine distribution operation, the state will be providing additional staffing resources to school systems and local jurisdictions as needed, and we are deploying Vaccine Equity Task Force teams to ensure equitable access for families in underserved communities and in hard-to-reach areas. The Maryland GoVax Call Center, which has already scheduled more than 460,000 vaccination appointments, sent over 1.5 million outbound texts, and made more than 11 million proactive outreach calls to eligible Marylanders, is immediately launching a new, robust effort to reach the parents of all eligible Maryland children. We will also begin airing a brand new round of public service announcements on radio and television featuring trusted Maryland pediatricians encouraging vaccination. As with each previous phase of our vaccination campaign, you can find a provider near you and make an appointment for your children by visiting covidvax.maryland.gov or by calling 1-855-MD-GO-VAX. Our primary goal with all of these actions is to make sure that parents have all of the information that they need to make the best informed decision for their family, because ultimately this decision is up to and should be up to Maryland parents and families. I know that many parents are relieved, and they have been looking forward to this day for many months, and they've already decided to move forward immediately to protect their kids, to avoid unnecessary outbreaks and disruptive quarantines, and to help keep kids in school. I also know that there are some parents who want to do what's best for their children, but who still have concerns or questions that they need answers to. It is important that they get all of those questions answered, which is why we've asked these pediatric experts to be here with us today, and it's why we are strongly encouraging parents who do have concerns to talk directly with their pediatricians or their family physicians. It has now been 11 months since we began our massive operation to get shots into arms in an effort to bring this pandemic to an end. Thanks to the millions of Marylanders who've rolled up their sleeves, Maryland continues to be one of the most vaccinated states in America. We have now administered more than 8.5 million COVID-19 vaccines and over 430,000 booster shots. Nearly 99% of Marylanders 65 and older have been vaccinated, and more than 86% of Maryland adults 18 and over have been vaccinated. As a result of all these efforts, all of our key health metrics continue to decline across the board. Our COVID-19 positivity rate has dropped by 41% in recent weeks. It's down 89% from its peak. Our case rate has declined by 43% in recent weeks and is now down 78% from its peak. And hospitalizations of COVID-19 vaccines for children. Dr. Chen?
Thank you, Governor, and good afternoon. So throughout the COVID-19 pandemic, I have spoken about COVID-19 vaccine, testing, and more. As the Deputy Secretary for the Maryland Department of Health, as a physician, and as a mother. I am here today again in all three of those roles, but most importantly, in my role as a mother who has children between the ages of 5 and 11 who now are eligible to get vaccinated against COVID-19 disease. Families, including my own and my wonderful husband, across the state and country have been challenged throughout the pandemic to be able to keep their children safe while making sure that they can attend school, participate in activities, and just be kids and hang out with their friends. We are at a crossroads in this pandemic where a number of positive points are converging. We are in the midst, as the governor indicated, of seeing a decline in COVID-19 cases, hospitalizations, and deaths across the state. We can vaccinate 515,000 of our children who are between the ages of 5 to 11 years old to protect them against the disease. They, like all of us, have been at risk of contracting COVID-19 over the last 20 months, and it's now their turn and our responsibility to be able to ensure that parents have the information they need to get their children vaccinated. Since we began vaccinating Marylanders almost a year ago, we have seen the benefits to those who have been vaccinated, including a decrease in the risks of infection, hospitalizations, and death. However, over this same time frame, the proportion of COVID-19 cases among the younger age groups who have not yet been eligible for vaccination has increased, meaning at the beginning of this year, 2020, about 6% of all of our COVID-19 cases were under 10 years old. But more recently, in the last few months, about 14% of our new cases have been among this age group under 10. So over the course of the pandemic, I also want to emphasize we have seen kids not only get infected, but also be hospitalized. And so we have seen about 700 hospitalizations among children under 12 years of age. Now that 5 to 11-year-olds are eligible, peace of mind for us as parents is certainly one reason to get them vaccinated. But the more important one is to protect them, our families, our communities, and Marylanders from this disease. Vaccinating kids is another important step in our ongoing battle against the COVID-19 pandemic. And this is exactly what more than 85% of Marylanders who are 12 and older who have chosen to become vaccinated, and why our health metrics are trending in the right direction. So let me talk a little bit about the Pfizer-BioNTech COVID vaccine that just got approved by the CDC yesterday after the advisory committee met and voted to recommend approval for use of this vaccine. So this vaccine has been approved under emergency use authorization for children already 12 to 15, and what the FDA and CDC have done now is expanded that EUA to include children 5 and up. Just as a reminder, the EUA is a way to facilitate the use of medical products, including vaccines, during public health emergencies, even as we're currently undergoing, responding to the current pandemic. Throughout the pandemic, the FDA has maintained its stringent protocols and procedures to review safety and efficacy data for all vaccines, and that has not changed. And in fact, the FDA has among the most stringent procedures and criteria around the world. So it is a safe vaccine and 90.7% effective at preventing symptomatic infection from COVID-19 among the 5 to 11 variant. This vaccine is very similar to the vaccine that's administered now to the 12-year-olds and the teenagers and adults. It is still a 2-dose regimen that's spaced 3 weeks apart. However, the dosage itself is a smaller amount. It is a dose for the dose for 5 to 11-year-olds is 10 micrograms, which is about a third of the 30 microgram dose that's in the vaccine, the Pfizer vaccine for 12 and older. This amount was shown to still produce a very robust immune response while balancing the short-term side effects that the vaccine can produce. The vaccine itself is also packaged differently to ensure that providers administer the correct Pfizer vaccine dose. The 5 to 11 vaccine comes in a smaller vial and has an orange cap on it, while the vials for the 12 and older have a purple cap. So again, this is to allow providers to make sure not to provide the correct dose and the correct vaccine. I'm sure that parents have a lot of questions about possible side effects that their children may have if they become vaccinated. And as with 12-year-olds and many people across the state have gotten vaccinated with the Pfizer vaccine, kids may also experience some side effects, which are normal signs that their body is actually responding to the vaccine itself. So side effects are typically mild, and that was seen in the trials as well, and shortened duration, maybe about 2 to 3 days, and include pain, redness, and swelling at the site of injection, as well as tiredness, headache, muscle and joint pains, a mild fever, and chills. These common side effects are expected and are usually able to subside or go away within 2 to 3 days, as I mentioned. Some children may actually not experience any side effects at all other than a mild sore arm. It is also important to note that any side effects are much less severe than actually getting COVID-19 infection and being ill from it. In addition, as many as half of the children in the United States who have contracted COVID-19 infection may experience ongoing symptoms in the weeks to months after their initial commonly in kids, for other reasons. There have been some cases where the heart muscle inflammation happens in vaccinated adolescents and in young adults. And it's important to note that these two conditions are also associated with COVID-19 disease itself. And in fact, Maryland has seen 158 cases of the multi-inflammatory syndrome in children, or the MIS-C, which is a post-COVID disease syndrome seen in children, characterized by severe inflammation of multiple organ systems, including the heart, lung, kidneys, and gastrointestinal systems. Many of these kids are quite ill and do end up in the hospital because of this post-COVID syndrome. Among the folks who have been vaccinated, and there's been tens of millions of people who have received vaccines across the United States, the CDC and FDA have confirmed fewer than 900 reports of myocarditis or pericarditis, most of which have occurred in adolescent boys and young men after receiving either the Pfizer or the Moderna mRNA COVID vaccines. So while there are occurrences of myocarditis and pericarditis, it is a much smaller risk related to the vaccine than actually getting the infection itself. So as the governor said, earlier today, we instructed all COVID-19 providers in the state to begin vaccinating 5 to 11-year-olds. We expect to have ample vaccine supply in the state to meet the demand in the days and weeks to come. We are excited that we can now vaccinate this age group, and we know that a lot of parents will feel relieved that their children can now get a safe and effective COVID vaccine and the protection that it brings. The more we are vaccinated as a population, the more we can cut off the spread of disease and the development of variants, and the more we can get back to normal activities and the lives that we want all of our children to have. So for all the parents out there, please look for a vaccine. It is in the state. We've already begun vaccinating. Find a vaccine nearest to you. Contact your local health department. Talk to your pediatrician. The vaccine is coming. We look forward to our Thanksgiving meals and the holidays in the wintertime. So I'd like to now introduce our next speakers, who are among the many community pediatricians who are caring for children and families and who are prepared to vaccinate children in their own offices. So first, Dr. Monique Swallow-Burke is a pediatrician at the Pediatric Center in Columbia, Maryland, and she also serves as the clinical instructor at Johns Hopkins Hospital and is the vice president for the Maryland chapter of the American Academy of Pediatrics. Following will be Dr. Michael Zollicoffer, a pediatrician in Baltimore, who has been in practice for more than 20 years. He is also the Maryland GoVax ambassador, so you may have seen him on TV, and is affiliated with Sinai Hospital of Baltimore. Dr. Burke?
Thank you. Good afternoon, everyone. On behalf of the 1,100 members of the Maryland chapter of the American Academy of Pediatrics, I'd like to thank Governor Hogan for inviting us to join him today to celebrate, and I do mean celebrate, the approval of the Pfizer COVID-19 vaccine for 5 to 11-year-old children. I also want to take a moment to thank the pediatric healthcare providers who have dedicated their lives to take care of these children and to dedicate ourselves to the well-being of our youngest citizens. I'm also really proud to be part of that team. This week, I've been thinking a lot about a book I often read in the library of my first grade classroom. It was called The Red Letter Day. The book was about a little boy who had a really exciting event coming up, and he put it on his calendar and he wrote in all big red letters. Well, today is the Red Letter Day, the day that parents and pediatricians have been waiting for a really long time. I often tell people that I have the best job in the world. I love my job. I have one biological child and hundreds of other children, all my patients. I love them all like a parent, and I want what's best for them. Over the last 20 months, I have watched them suffer in ways that I never imagined. A special needs patient of mine was admitted to the ICU with COVID-19 pneumonia. Another very healthy 14-year-old patient, whom I've been taking care of since she was born, now suffers from long COVID syndrome. Almost a year after her infection, she can't walk up the stairs at her high school. She can't play any sports. She doesn't have the energy to hang out with her friends. She's no longer independent, and she's just not normal. She can't have a normal life. Even my patients who have escaped infection haven't escaped the suffering. Developmental delays, social anxiety, depression, and the loss of part of their childhood. They've missed field trips and sleepovers and family gatherings, and today we have the opportunity to give it all back to them. As a pediatrician and a mom, I understand that parents and guardians, we want to do the right thing for our children. We would gladly sacrifice ourselves for them in an instant. Vaccinating our children is the right thing to do. It's safe, it's effective. I have a 13-year-old daughter. She was vaccinated the first day that the vaccine was available for her age group. And as I tell my patients, that is the best recommendation I can offer. I would never ask anything of anyone's child that I wouldn't do for my own. Today is a day to celebrate, a day to give thanks, a day to give our children their lives back. I do want to give a shout out. We gave our first 2 vaccines in our office just before I left to come today. So I promised the 5 and 8-year-old that were the brave people that I would give Piper and Matthew a shout out for getting their first shots today. So congratulations. Again, thank you for having me here today, and I'm excited about vaccinating the children of Maryland.
Good afternoon. Good afternoon to the governor and Dr. Chan and the media. My name is Dr. Michael Zollicoffer. They call me Dr. Z. You don't want to say Zollicoffer too long. I'm still having problems. I've been doing it for 63 years. I have been in practice there for over 35 years, and I followed my father, who died at a young age of 45 of colon cancer, but who also was in pediatrics and served this community. I remember very well as a young child riding with him doing house calls in the projects in the inner city. We care about Baltimore City. He and I both care about the city and this state. We care about our children, and I cannot emphasize that more. Before I even get into the body of my talk, I want to say and give condolence to one of my colleagues who also championed for 20-some years the health care of inner city children and lower socioeconomic groups, Dr. Eric Dobson, who tragically had a massive heart attack 3 months ago and passed. I want to give condolence to his family and his patients. And I also want to say that Eric sent a message from upstairs to all of us. He heard about the 5 to 11 vaccine, the immunizations that we're getting. And he said, we have hope today. That's what we have today. We have hope. The pandemic has killed 745,000 people. Not many children, but too many. We have hope today. Nearly 2 million children, 5 to 11, have been infected. We have hope today. 8,300 children from 5 to 11 have been hospitalized. 2,300 children have been infected with the multi-system inflammatory syndrome, with 94 dying. Have 3 in my practice. Gladly, none of them have passed. But they want to send a message to everybody. We don't want this. You don't want this. So please get immunized. We have hope today. Zalia Ramirez, a 10-year-old from LA, who spent 7 days in a coma and was inches from losing her life. Her family all were immunized, but she could not because she was too young. That changes today. She can now be saved. We have hope today. When she was discharged from that hospital, and I quote her, she said, "Mommy, I don't want to get sick again. I don't want to get sick again." And now she has a chance, and other children also, so that will never happen. Parents, you have a chance to save your children. The decision is yours. You don't got to get the shot, but I'm pleading with you. I'm pleading with you to do so. Just ask Zalia. She said, "Mommy, I don't want to get sick again. I don't want to get sick again." So parents, let's save our children. There are 28 million children between 5 to 11 that are now open for vaccination. Let's get immunized. Many of the children in inner cities and some rural areas lose the schools for a safe haven. They get their breakfasts, their food there. They take after-school programs. This shot will make that safer. Let's get hope again. The shot is 91% effective. The shot is about 1/3 of the dose that we give to adults. It's a 2-shot regimen like all, and it's a very safe shot with minimal side effects. This is a good shot. This is a good shot. We have hope today. So let's be patient, though. This is going to happen overnight. Let's take our time. Let's not rush out and go berserk. We know it's going to be difficult. You're talking about 5-year-olds getting a shot. It's going to have to last to a few of them. They're going to be screaming and hollering. Pharmacists are going to be doing stuff they never did before, taking care of a 5-year-old when he kicks you and does other things to you. We got to get ready. But guess what? They all have hope today. So listen to me. We have a safe shot. We have an effective shot. We have a dread disease. We have needless deaths. And you put that all together, and for the 5-year-olds, we now have that pot of gold at the end of the rainbow. The leprechaun can keep away from the pot of gold because this is what he can say. Yesterday, you were defenseless. Today, you have a weapon that gets you closer to herd immunity. The faster we get to herd immunity saves the most lives. That's for my PSA. And it will help us navigate the pandemic and this continuum of destruction and needless deaths. We got hope today, people. We have hope today. I want to thank you all, the governor, the Secretary of Health, and I want to thank all of you and the parents and everybody in Maryland for letting me have a chance to speak to you about something that I'm forever excited about, the health of our children and the betterment of our community and nation. Have a great day, and let's get out here now and go to work to save our children. Thank you.
Wow, first of all, I want to just thank all of our doctors for being here today. I'm not sure I should ever do another press conference again. I want to thank Dr. Z for taking us to church. I felt like saying, can I get an amen? But thank you for making it hard for me to follow you. We're going to open up the floor to any of our panelists here for any questions that anybody has. I'm sure there are a lot of them. I want to kind of stick to on-topic questions before I may take some other things that you want to talk about. But let's see if anybody has any questions for either for me or for any of the doctors or the secretary.
Governor, how long will it
I think it just jumped right in front of Kate. No, we'll come right back to you, Phil.
Governor, how many, in addition to the 180,000 doses, And this is still a work in progress. We know we're going to get the 181,000. We don't have visibility yet on the pharmacy doses, but we're working on getting that data as soon as we can. And the first 63,000 have arrived or in transit. And so we've already received 23,000 doses in the state, with the others in transit. And as you heard from Dr. Burke, we're already starting to give the shots out. So we're going to be monitoring the system that the doses are communicated for the allocation, and as soon as we know, we can let you know.
So just so our viewers and your viewers know, if your kid gets a shot at CVS over the weekend, that vaccine didn't come from Maryland, it came from
Federal, yes, that's not included in the 181,000. We're still trying to get visibility on that number, but we don't have that yet.
Yeah, just to add to that, that's the way it's been throughout the process with the federal pharmacy programs. They went directly to them. In fact, all the doses come from the federal government. We just put in the request and direct them where they should go. The pharmacies are just separate than the rest.
Governor, how long will this take? Or what's the timeline in getting as many kids vaccinated as you can or want to? What does your intel tell you on that?
Well, maybe I'll let either Secretary Schrader come up and talk about that. Obviously, we want to try to do things as expeditiously as possible. But we also want people to make sure that they're confident and comfortable and that they get their questions answered. We don't think it's going to happen overnight. I think Dr. Chan mentioned that it's going to take us a while, but we're going to stick to it until we get everybody who wants a shot to get one.
Yes, sir. So our models are based on what we saw for the 12 to 15-year-olds. We're expecting, as we, a third of 515 is about 180,000. So that first round of doses will be coming in. 3 weeks later, we'll start doing the second shots. Our expectation is that about a third of them will come in the first 3 or 4 weeks. We'll get that surge. And then our experience has been a flattening and smaller numbers of shots week over week. That's what our model says. That could be different, but that's what we're thinking at the moment. So this will take many, many weeks to get, because we've got to reach people. That's one of the reasons we're encouraging the schools to hold clinics. And if that's effective and we get parents' consent, that could change the curve. But we're waiting also to hear, the other question was how much additional allocation we're going to get week over week.
Quick question about the 181,000 doses that the state has ordered. Is the plan to use all of those doses to give initial first shots, or is there a plan to set aside doses to make sure that kids who get first doses are ensured a second dose in 3 weeks?
Great question. Because we are expecting the doses in the 180 to be distributed in terms of demand and in that first 3 weeks, the guidance we're giving to pediatricians in particular is that they have to manage that first and second dose distribution, and we are giving many, many doses to the local health departments to manage. So we're going to allow the providers to self-manage, and they understand that 3 weeks later they need these doses. That's one of the reasons why we've got to carefully track when the next allocations are going to come. We've done some modeling, and it suggests that it'll be tight, but we believe that based on the uptake we expect to get, that we will have enough doses for second doses come week 3, 4, 5.
So to be clear, the recommendation is not necessary. You're giving providers the opportunity to manage this, but you're not recommending that they hold back the second dose.
No, but and quite frankly, some of them may decide to do that. It's really their call. But we're tracking the allocations very carefully, and if we're expecting another by 50,000 doses per week, but we haven't, and we've been assured those will come. But we're still tracking the allocation process. If we get that, we should be in good shape based on our expectations from the models.
Secretary, could you also speak a little bit more about ensuring that the distribution is equitable?
Yes. Yes, and with Dr. Chan's help, and I'll ask her to add any commentary that I missed. She's been working very closely with the local health departments, the local health officers, and the school system superintendents. There's been several calls. We have asked the superintendents in the state to assure that they would hold clinics in the schools, because we believe that's the best way to get equitable distribution, by reaching the children in the schools. Of course, there's a consent process and all of that, but that is our strategy at the moment. Dr. Chan, did you want to add anything to that?
No, I think, thank you, Secretary. I would just add that, those clinics are being planned as we speak, and, will be starting to take place, even next week and in the weeks to come. And local health departments are also planning mobile clinics to get into communities that perhaps have not had access to vaccines historically. Our Vaccine Equity Task Force that has been stood up since February and working really hard around the state to get vaccines into some of these hard-to-reach populations and into communities is also standing by, ready to go. And so we have a number of tools in our tool belt to really get into communities and to work with partners, community partners, schools, and others to get vaccines out.
Doctor, is there a way to quantify how many school-based clinics there will be? There are probably a lot of parents out there wondering, will my child be able to get it if they're at school? And how much, is it going to be like half, or is there a way to make a number on that?
So I know that all school districts are working to establish school-based vaccines, as the Secretary and the Governor have indicated. In terms of the number of clinics, they will probably be adding clinics as they get vaccine, because right now we only have visibility on that 181,000 that we've been talking about, and so those have been pre-ordered already and are just now coming into the state this week. And so they're going to start by using those, but as we get more information about future weeks allocation, I anticipate that other clinics will be established.
Dr. Chan, I wanted to ask, yesterday in Anne Arundel County, Dr. Khalil Rahman indicated that they're anticipating about a third of their kids, or parents and families to come forward initially and say, all right, let's do this. About a third are going to wait and see, and about a third are going to say, no, we don't want the shot. On a state level, what are you all anticipating in terms of these phases?
I think that's exactly speaking to what the Secretary just alluded to. When we looked at the uptake of the 12 to 17 or 12 to 15 vaccines back in May when it was approved for that age group, we saw that the uptake within the first 3 to 4 weeks was about a third of that total population. So that's what we are anticipating happening, is about, same breakdown, around a third of the 515,000 total Marylanders who are 5 to 11 will likely get a vaccine in the next 3 to 4 weeks, and then it might plateau off. And so that's what we anticipate, as the Secretary said.
Dr. Chan, in terms, we keep hearing one people who saying kids are not just small adults, and we treat them differently, you have to administer vaccine differently. Have you had to order different supplies, different needles, different things to vaccinate little kids? And have there been any supply chain issues on that front?
So I think that as it has been since the beginning of the vaccine campaign, the federal government has been, front and center in terms of the logistics and operations of sending the vaccines and the supplies, so including, alcohol pads and syringes, needles, et cetera, out. So they did change the syringes for this vaccine. The other thing that changed is that the package sizes are smaller. So you may have heard, and this had been a big logistic issue for us, that the Pfizer vaccine would come in these large trays, multiple trays of 1175. So that's a lot of doses to manage. So now they've repackaged it so it's actually smaller in quantity. But what that means is that the supplies that come with it also have to be repackaged in smaller quantities. So, that's not on us per se, so we have not purchased additional supplies there, but the supplies are coming with the vaccines, and as you've heard, they are, coming together, and kids are starting to get vaccinated around the state.
A question for Dr. Rosen. Both of you and Dr. Zollicoffer spoke very passionately about getting children vaccinated. There is a growing debate about whether or not this should be considered a vaccine among the group of things that we require children to be vaccinated for before attending school. Is there a consensus among pediatricians,
So I don't think that at this point they've come out with a statement about whether they think they should be required for school. I think that we will need to take a look at data and make decisions as we progress. I will say that we're pediatricians. We believe in vaccinations. Vaccinations save lives. We're very good at giving vaccinations. We give thousands of them a year. So I think that, at your pediatrician's office, this is certainly a good place to get information about vaccines and talk to someone who's very comfortable with vaccine dispensing and with the side effects and things like that. So I think it's really, at this point, an important one-on-one conversation to have with your pediatrician.
Anyone else?
Governor, in regards to the election results in Virginia yesterday and the race in New Jersey, which is still apparently too close to call, what are your thoughts on that? And does that change your position about this consideration about possibly running for president?
Look, I reached out to congratulate the governor-elect in Virginia last night. I'm looking forward to hopefully sitting down with him. I'm very much looking forward to working together with him in the region. I'm going to welcome him to the RGA and the NGA, and I think he's going to do a terrific job. It sent quite a message, I think, that they swept all of the statewide elected offices in Virginia. Jack Citarelli, I also have had conversations with. He's a terrific guy who no one expected to win. Youngkin, we were talking about for months, and he had unlimited amounts of money in his campaign. He got a lot of national attention. Jack Citarelli reminds me of, Larry Hogan, because he had no money, no one expected him to win, and he came out of nowhere. We haven't got the final answer yet, but there's a chance that we may be also welcoming another new governor in New Jersey. I think it was great. I think it sends two messages, basically. One, that people that actually focus on talking about issues and solutions get rewarded by the voters. And two, that perhaps President Biden, who ran as a centrist who was going to bring the country together, overread the mandate on moving too far to the left. And I think that was rejected by the voters all across the country, not just in those two states.
Governor, is there a national takeaway from last night regarding funding of police that applies here to Maryland?
Say that again?
Is there a takeaway from the national results on police funding that is applicable to Maryland?
Well, when they first started talking about defunding the police, back in May of last year, I was the first one on national television strongly disagreeing with that. Last week or so, after we heard a Baltimore City councilman talking about eliminating the police in Baltimore City, we talked about more funding for police. I just saw, obviously, that everywhere across the country, that people that said that won their races. People who talked about defunding the police lost their races. Mayor of New York is a former cop who said it's crazy, you can't take money away from the police. He was elected over all of the people that other people thought were going to win. I just saw some polling a couple days ago, national polling. 75% of people in America agree with me and want more funding for police, not less.
Arizona and Connecticut passed sports betting at the same time as Maryland, and they've both been live with sports betting for several weeks. Today, the SWOR punted on their entire agenda. Do you have any insight into what happened, and do you have any reaction?
Yeah, on sports betting, it's a very frustrating situation. Obviously, the voters overwhelmingly voted for sports betting. The legislature passed a bill, they crafted legislation, which they now seem to be, they passed a law that they seem to be ignoring. The executive branch of government approved all of the existing sticks and bricks, folks that have already been vetted and already doing gambling across the state many weeks ago. As far as we're concerned, they should have been taking bets ahead of all those states. It appears as if the legislature and staff for the legislature, even attorney for the legislature, is pressuring that commission to delay things as long as possible until they can do all of the other brand new licenses where companies haven't even yet been formed, haven't really applied, haven't been vetted. The end result of delay, which is the opposite of what the law says. The law says they should do the others first and have two separate processes. If in fact they don't act immediately and approve those, and if the legislature has their way, in violating the law, then it's going to be at least a year or more before anyone gets the ability to do gambling in Maryland, sports betting, and potentially it could kill the entire deal. So I didn't see the details of the secret closed-door meeting they had today. It kind of reminds me of redistricting, where you don't get to see what they do. But it's a problem, and I mean, I'm sure they're all going to be sued by all the people whose licenses have already been approved. Thank you.